Welcome to the deep dive. Today, we're jumping into something really fascinating, maybe even a bit unexpected. We're looking at hyperbaric oxygen therapy, HBO,
Right.
and how it's being used for problems in the gastrointestinal system.
Yeah, it's not the first thing most people think of for gut issues.
Exactly. So, the basic idea with HBO, it's actually quite simple. You breathe pure oxygen, but inside a pressurized chamber.
It's like giving your body a big oxygen boost.
Right. And this extra O2, it can get into tissues that are struggling, ones that aren't getting enough oxygen.
Yeah.
What doctors call ischemia or hypoxia.
And that can really kickstart healing. Plus, it has this interesting effect of shrinking down gas pockets in the body.
Which, as we'll see, is pretty relevant for the gut.
Definitely.
Yeah.
And what's so interesting is how that core idea, more oxygen, managing gas, seems to apply to so many different things in the GI tract.
Like what kind of things?
Well, everything from, say, peptic ulcers that just won't clear up to really complex bowel blockages, even inflammatory diseases like Crohn's and colitis.
Wow, okay. That's a wide range.
It is. So our mission today is really to pull out the key takeaways from the research, the clinical observations, and give you a good handle on this technology and where it might fit in the GI world without, drowning you in technical stuff.
Sounds good. Okay, let's start with something pretty common, unfortunately. Peptic ulcers?
Right. Most people know about the acid, the enzyme pepsin, maybe that H. pylori bacteria.
Yeah, the usual suspects.
But what our sources really highlight is another factor, especially for stubborn ulcers. Poor oxygen supply in the stomach lining itself. Gastric mucosal ischemia.
Okay, ischemia, lack of oxygen. So how does that connect?
Well, it gets interesting here. Studies in dogs actually show that tissue damage, like necrosis, it starts when oxygen levels drop too low.
And they found that in humans, too.
They observed similar low oxygen levels right near the edges of human ulcers. So the logic for HBO starts to make sense, doesn't it?
Yeah, get more oxygen to that damaged area to help it heal up.
Precisely. And the animal studies really back this up. They gave rats ulcers
How did they do that?
using acetic acid. Then they treated some with HBO at 2 ATA. That's atmospheres absolute, so twice normal air pressure.
Okay.
And over about 10 to 16 sessions, the HBO group had much faster healing, better tissue regeneration.
Compared to the ones that didn't get it.
Right. The control group had a really low rate of healing on their own.
Yeah.
It suggests tackling that oxygen deficit really matters.
Okay, animal studies are one thing. What about people? You mentioned a single case report from the 70s.
Yeah, from Perrins in 77, a healed case in the West. But the bulk of the human data actually comes from Russia, highlighted in our sources.
Oh, interesting.
Yeah, several studies from the 80s, we're talking hundreds of patients, gastric ulcers, duodenal ulcers, treated with HBO, usually 10-15 sessions at that same 2 ATA pressure.
And the results?
Really high healing rates reported, somewhere between 65% and almost like 96%.
96%, wow.
Yeah, and maybe even more importantly, that the healing time was much shorter compared to just standard medication, sometimes weeks shorter, like 7 to 28 days less.
That's a big difference. It wasn't just that they healed, but they healed faster.
Exactly. And what's kind of intriguing is that they noticed more mucus secretion during healing, and the stomach acid was still there.
Which you'd think would slow things down.
You might think so, but the ulcers still healed very well. And the research suggested HBO doesn't really change overall acid production.
So it's not an antacid effect. It's more about boosting the tissue's own healing power, maybe?
So that seems to be the idea, helping the lining become more resilient despite the acid.
Okay. And our sources mentioned another angle, the H. pylori bacteria.
Right. Given that HBO can have antibacterial effects elsewhere, the question arises, could it be doing something to H. pylori too?
Makes sense to ask.
It does.
Mm.
But the researchers are very clear that specific idea needs proper studies to figure out. It wasn't directly proven in those Russian reports.
Got it. So lots of patients in those studies, impressive results, but maybe not the gold standard trials we look for now.
Exactly. No double-blind, randomized controlled trials. So, we need a little caution interpreting them.
But still,
It's a compelling amount of clinical experience, especially suggesting it could be useful for those really difficult refractory ulcers that aren't responding to anything else.
Yeah.
It definitely warrants more investigation.
okay, let's shift gears. Moving down the GI tract. Intestinal obstruction, bowel blockages.
Right, and this isn't just one thing. You've got paralytic ileus.
That's where the bowel just stops moving. like after surgery sometimes.
Yeah, it goes quiet or due to other medical issues. And then you have mechanical ileus, which is a physical blockage.
Like scar tissue, adhesions.
Adhesions are a big one, yeah.
Yeah.
Or tumors, or even something swallowed.
And in both types, gas buildup is a major issue, right?
Huge issue. And a lot of that gas is nitrogen from swallowed air. The problem is our body tissues are already full of nitrogen, and it's just hard for the gut to absorb it quickly.
Okay, so how does HBO help there?
This is where the physics gets really neat. Boyle's law.
Ah, pressure and volume.
Exactly. Volume goes down as pressure goes up. So if you double the pressure to 2 ATA in the HBO chamber, you theoretically cut the volume of that trapped gas in half, 50% reduction.
Wow. And that would make the bowel less stretched out.
Precisely. It can lead to almost a 30% reduction in the diameter of the swollen bowel. It's about relieving that dangerous pressure on the bowel wall.
Because that's stretching the distension, that's what cuts off blood flow, right?
Yeah.
Causes the ischemia and hypoxia we talked about.
Exactly. It compromises the bowel wall, stops it contracting properly, and risks tissue death. So reducing that distension is critical.
Makes sense. Any evidence this works?
Yeah, animal studies again provide some backing. Way back in '65, Cross showed breathing air at higher pressure improved bowel viability in dogs with obstructions.
Yeah. Okay.
Hopkinson and Schenck found HBO reduced mortality in dogs with colon blockages. And newer rat studies suggest HBO might help restore enzyme levels and even reduce bacterial problems after obstruction.
Okay, let's focus on the adynamic kind first, the paralytic ileus. What about human studies there?
There are several mentioned. Stewart and colleagues saw improvements back in '74, though the patients were very ill. Watnicki used lower pressure HBO successfully after surgery. And a larger study by Ratner's group, over 200 patients, actually showed lower mortality in the HBO-treated group compared to controls.
That sounds significant.
It does. And there's a big pediatric study, too, by Gurkowski, though without controls. They found HBO was very effective, especially if started early after surgery for things like peritonitis or ileus.
And others.
Loda reported success in infection-related ileus. Saito showed in dogs that HBO reduced bowel diameter and boosted oxygen levels in the bowel wall itself.
So, direct proof of increased oxygenation.
Right. And perhaps the most compelling is a retrospective review by Mbiru's team. They looked back at over 600 post-op patients with paralytic ileus who got HBO.
Yeah.
A 92% resolution rate. And mortality was really low, just 1.2%.
92%, that's huge. Seems like a strong case for using it after operations.
It certainly looks that way. Now, shifting to the adhesive obstructions, those physical blockages from scar tissue.
Right, the adhesions.
This area is a bit more debated for HBO.
Why is that? Seems like just adding oxygen wouldn't physically break up scar tissue.
That's the intuitive thought, yeah. But Mbiru's group did a clinical trial here too, and they found HBO actually led to good resolution and survival rates, even in patients who hadn't improved after a week or more of standard non-surgical treatment.
Huh. So maybe it's not dissolving the adhesion, but doing something else. Reducing swelling, maybe?
That's a plausible idea. Reducing inflammation, improving blood flow around the blockage, helping the bowel cope, even if the physical band is still there.
Interesting. Any other studies comparing it?
Yes. Fukami and colleagues compared HBO directly to using a long decompression tube.
Okay.
They found HBO had a higher success rate without needing the tube, almost 88%.
Wow.
Plus, those HBO patients could eat sooner, left the hospital earlier, and were less likely to end up needing surgery.
Those are pretty major benefits for the patient.
Definitely significant advantages. And there's also a hint from a case series that HBO might help with those really tricky recurrent obstructions you get after radiation therapy.
Oh, right. Radiation damage.
Yeah, that can be tough. And there's even a fascinating case study looking at chronic idiopathic intestinal pseudo-obstruction.
Pseudo-obstruction, so looks like a blockage but isn't.
Exactly. All the symptoms, none of the physical blockage. In one patient linked to a muscle issue, HBO was apparently very effective at easing symptoms and reducing that gas buildup.
It really seems like HBO is working on multiple levels here. Gas volume, oxygenation, maybe inflammation.
It does appear multifaceted. Which brings us nicely to inflammatory bowel disease, IBD.
Like ulcerative colitis and Crohn's disease.
Right. These are chronic inflammatory conditions. Cause is still not fully pinned down, but they cause a lot of suffering.
So how might HBO help here? Is it just the oxygen again?
Oxygen is likely still part of it, helping damage tissue. But the main angle here seems to be HBO's anti-inflammatory effects and maybe helping the bowel lining heal.
Okay. Evident.
Well, an animal study by a tug found HBO was as good as a strong steroid, dexamethasone, at treating induced colitis in rats.
As good as a steroid. That's impressive.
It is. And we see positive signals in human case reports, too. Bookman described a patient with refractory ulcerative colitis, meaning it wasn't responding to usual treatments who achieved remission with HBO.
Remission.
Wow. And they could even cut back on their steroids. Green reported similar good outcomes in kids having Crohn's flare-ups treated with HBO.
Okay, case reports are encouraging. What about larger reviews?
Rosignol reviewed multiple studies in both Crohn's and UC, often focusing on patients resistant to standard therapy. A high percentage showed clinical improvement with HBO.
Improvement.
How? Fewer symptoms, better overall condition. And interestingly, some studies actually measured inflammatory markers, like cytokines.
The body's inflammation messengers.
Exactly, and they found levels of these pro-inflammatory cytokines went down after HBO.
So it seems to be actively calming the immune response.
That's the suggestion. Animal studies also point that way, showing reduced markers of inflammation and oxidative stress in the gut with HBO.
But you need the usual caveats, right? Small studies, lack of control sometimes.
Definitely. A systematic review by Dulai looked at 17 studies, over 600 patients total, and found high overall response rates, 86% in Crohn's, 88% in UC.
Still sounds pretty good.
It does, but they strongly emphasize the need for proper randomized controlled trials to really nail it down.
And is all the evidence positive?
Not entirely. Our sources mention a randomized study by Pagold. They compared standard treatment plus HBO versus standard treatment alone for ulcerative colitis. They didn't find a significant difference.
Oh, so it's not a slam dunk?
No, it highlights the complexity. Maybe it doesn't work for everyone, or maybe the specific protocols matter. It shows why those controlled trials are so important.
But is there any idea why it might work in some cases? A mechanism?
Potentially. A study by Beckheit suggested HBO might actually stimulate the stem cells in the colon.
Stem cells to rebuild the lining.
Exactly. Promoting healing of that damaged mucosal lining, which is key in recovering from ulcerative colitis.
Okay, that's an interesting angle. Now, what about actual infections in the GI tract?
The sources touch on a few serious ones. Toxic megacolon first.
That sounds bad.
It is. Rare, but potentially lethal complication of IBD, where the colon gets massively dilated. Kudraki suggested HBO might be a safe, non-surgical option, likely due to those anti-inflammatory effects we just discussed.
Okay, what else?
Pseudomembranous colitis, that's the one caused by C. diff, Clostridium difficile.
Right, often after antibiotics.
Yeah. Vancomycin is a key treatment, in many cases resolve. But HBO has shown some potential as maybe an add-on therapy, though it needs more study.
And necrotizing enterocolitis, NEC.
A very severe condition, especially in newborns, where intestinal tissue dies. There's some very limited early evidence suggesting HBO might improve survival and help reduce gas in the damaged bowel wall. Just a couple of small reports, though.
Needs more research, then. And radiation enterocolitis. We touched on that with obstruction.
Right, the delayed damage after pelvic radiation. Some reports suggested HBO helped, especially early on when ischemia is the main problem.
But didn't you say a big trial found no benefit?
Correct. A phase 3 randomized study by Glover looked at chronic GI symptoms after pelvic radiotherapy and found HBO didn't help compared to a sham treatment.
So, again, context matters. Maybe timing, maybe the specific type of damage.
Precisely. It really underscores that HBO isn't a magic bullet. Its effectiveness seems very dependent on the specific condition and what's actually going wrong biologically.
Okay. Let's move to something called pneumatosis intestinalis, gas in the bowel wall.
Yeah, exactly. Air or gas-filled cysts literally inside the wall of the intestine. It's often secondary to something else like COPD, IBD, connective tissue diseases.
How does the gas even get in the wall?
Good question. 3 main theories. One is mechanical. A break in the mucosal barrier lets gas in. Another is bacterial gut bacteria producing excess gas that somehow gets absorbed into the wall. And the third is pulmonary tiny air sacs in the lungs rupture. Gas travels through tissues and somehow ends up in the bowel wall.
Wow. Okay. How do they diagnose it?
Imaging, X-ray, CT, MRI, they can show the gas pockets pretty clearly.
So if it's gas trapped in cysts, HBO seems logical again, right? Pressure.
Very logical. Similar to the intestinal obstruction idea, but maybe even more direct. Increase the pressure outside the cysts, they should shrink.
Boyle's law again?
Yep. And HBO is considered better than just giving regular oxygen because it more effectively lowers the gas pressure in the surrounding tissues. This creates a bigger pressure difference, a steeper gradient, between the tissue and the gas inside the cyst.
Pushing the gas out of the cyst more effectively.
Exactly, promoting deflation.
And does it work in practice?
The clinical reports are quite positive here. Mathis Fliegen reported rapid symptom relief and the cyst disappearing. Itsuga saw improvement in a patient who developed it while on steroids.
Any larger studies?
Grieve and Unsworth looked at 8 patients. They got symptom relief, but importantly, noted you need to keep treating until the cysts are gone, or they might come back.
Makes sense, like deflating a balloon completely.
Right. And there are numerous successful case reports, many from Japan, and even one linked to lupus that responded well. It really seems like a condition where the direct physical pressure effect of HBO is the key benefit.
Okay, that one seems fairly clear-cut. What about ischemic disorders? When the blood supply is cut off? Very serious stuff.
Extremely serious. And the experimental work in dogs shows that if blood flow is totally blocked, HBO by itself isn't enough to save the bowel. You still need blood flow restored.
Right, it can't replace perfusion.
No.
Yeah.
But a study by Takahashi looked at clots in the mesenteric artery in dogs. They found giving HBO for 3 days after the blockage actually helped.
Oh, so?
It reduced bleeding and swelling, and importantly, it seemed to promote revascularization, growing new blood vessels and tissue repair.
So maybe helpful during the recovery phase?
Potentially.
Mm.
And rat studies looking at ischemia or perfusion injury, that damage when blood flow returns. They suggest HBO can limit that damage. It seems to activate protective pathways, help cells keep their energy up, reduce inflammation signals like TNF-alpha, and stop intestinal cells from dying off.
But still not much human data for those acute artery blockages.
No, the sources mention a lack of human studies there. It's a difficult area to research ethically and practically.
Understood. Any other ischemic-related use?
Potentially helping surgical connections heal those anastomosis in the colon. Leaks are a big problem.
Right.
A rat study by Chemic suggested HBO, especially with a blood thinner, boosted new blood vessel growth and made the joint stronger, less likely to burst.
Interesting potential application there. Okay, now for something very specific you mentioned, removing trapped intestinal balloons.
Yes. It sounds niche, but these balloons used in procedures can sometimes get stuck and inflate.
And you can't just pull them out.
Not if they're over-distended. But again, Boyle's law comes to the rescue.
Put the patient in the HBO chamber.
Exactly. Several case reports document success. Using 2 to 4 ATA, often just for 1 or a few sessions, effectively compresses the balloon.
Deflates it enough to remove safely?
Precisely. Simple physics, really effective solution.
Okay. Let's turn to the pancreas. Acute pancreatitis.
Right, where the pancreas basically attacks itself. Very painful, can be very severe.
Role for HBO here.
Animal studies are mixed, but show some potential. Festigato found HBO reduced bleeding and tissue death in rats, but not so much the swelling and immune cell infiltration. But when combined with other agents, like N-acetylcysteine or something called 3-benzobenzamide, the result in rats looked better at reducing overall severity.
So maybe it's part of a combination therapy.
Possibly. And there's a hint it might work by causing certain inflammatory immune cells to undergo apoptosis-programmed cell death, which could help calm things down.
And clinical reports.
A few. Pilata reported improvement and lower amylase levels in patients. Christophe described a severe case improving, and Izawa found it useful for treating stubborn abscesses around the pancreas that can form after pancreatitis.
So some positive signals, but maybe not definitive yet.
Seems that way. Needs more research.
Okay, last major area, the liver.
Right, and the research here is quite varied, lots of animal work, lots of individual case reports, a bit harder to draw firm conclusions.
What did the animal studies show?
Some interesting bits, potential protective effects after blood loss, maybe stimulating repair, but it didn't seem to help if the main liver artery was tied off in dogs. And one study even suggested it slowed down liver regeneration after surgery in rats. So conflicting signals.
What about in humans? Severe liver disease.
There are some really old anecdotal reports suggesting HBO might help in hepatic coma, that's severe brain dysfunction from liver failure.
Anecdotal, though.
Yeah. And then a study by Bloom in kids with acute liver failure found no benefit and maybe even complications. Other early studies were also unconvinced it added much beyond standard care.
So not looking great initially.
But then later studies, again from Russia, reported recovery in patients with severe viral hepatitis and coma treated with HBO. And another study showed fewer long-term issues in kids treated with HBO for viral hepatitis.
A mixed picture, then.
Very mixed. There's talk about it helping eliminate toxins, maybe lowering ammonia levels in hepatic encephalopathy, There's a successful case report in cirrhosis with high bilirubin, even a child with acute liver failure treated with HBO and other things before a successful transplant.
So hard to pin down.
Very. The sources basically conclude most reports are anecdotal, hard to evaluate, but they suggest maybe exploring it further for hepatic encephalopathy, potentially due to that ammonia effect, and perhaps in drug-induced hepatitis. But it's far from established.
Okay, that covers a lot of ground. So let's bring it back to the main conclusions from the source material itself. What's the bottom line on HBO in gastroenterology?
Okay, so for peptic ulcers, they see it as a logical extension from skin ulcers. Tackling that oxygen deficit makes sense.
But needs more controlled studies.
Absolutely.
Right.
Especially looking at that potential H. pylori effect. But they do say, look, despite the lack of the double-blind trials, the sheer volume of positive Russian cases for refractory ulcers gives it some weight.
Okay, what about intestinal ischemia?
Needs more investigation is the main message. We know HBO boosts new blood vessel growth, angiogenesis, but we don't fully know how. We need to figure out optimal treatment schedules.
Right.
And maybe combining it with drugs for reperfusion injury. Human studies are tough here, ethically, for acute blockages.
And intestinal obstruction.
This looks like a promising area according to the source. Maybe the controlled studies for adynamic ileus aren't perfect, but the clinical experience is vast.
So potentially useful.
Yes, as an adjunct treatment for both paralytic ileus and adhesion obstruction, alongside standard care. But crucially, don't delay needed surgery for HBO if there's strangulation or perforation risk.
Makes sense. Use it wisely.
Exactly. Use it post-op or when surgery isn't the immediate plan.
So wrapping this all up, this deep dive really shows that HBO therapy has potential across a really surprisingly wide range of gut issues.
It really does, from ulcers to obstructions, inflammation, infections, even those weird gas cysts. The applications are diverse.
And the mechanisms seem varied too, improving oxygen, shrinking gas, maybe reducing inflammation, helping cells heal.
Yeah, it's not just one thing. It seems to tap into several fundamental processes.
And it's a big but we've heard throughout.
Right. The need for more rigorous research. While there's lots of encouraging evidence, especially maybe for adhesive obstruction and pneumatosis, we really need more high-quality controlled trials to properly validate many of these uses and figure out exactly who benefits most and when.
Absolutely. Science needs that solid proof.
It does.
So this exploration, it really highlights that connection between basic physiology, oxygen, pressure, and clinical medicine. And it leaves us with a thought, doesn't it? Well, given how HBO seems to work in the gut through these different ways, oxygen, gas, inflammation, cell function, what other seemingly unrelated medical problems might benefit? If we think about the core role of oxygen in disease, where else could this apply?
That's a great question to ponder. Thinking fundamentally about oxygen's role, it could open up new avenues.
Definitely something to think about.
Well, this has been a really fascinating look at HBO and gastroenterology. We hope this deep dive has given you a good overview and maybe sparked some interest to look into the research further.
Thanks for joining us on the Deep Dive.